Hello and welcome to my channel. So my topic for today is leukemia and lymphoma. But to understand the topic of leukemia and lymphoma, first we need to discuss the proliferation disorders of WBC, because these are the conditions in which the level of WBCs increase. So the first disorder is reactive, in which WBCs increase in blood due to some inflammation or infection or stress or trauma, etc. So for example, if there is any inflammation or infection or stress, large amounts of WBCs are released into the blood, and this response is called reactive. Reactive disorders are of two types: leukocytosis and leukemia reaction. In leukocytosis, there is mild increase of WBCs in the blood, which is commonly less than 20,000 per microliter. While in leukemia reaction, the WBCs increase in blood is high, which is commonly more than 20,000 and maybe up to 50,000 per microliter. We must know that normal WBC level in the blood is 4,000 to 11,000 per microliter. The important point here in reactive disorders is that quantitatively they may be in high numbers, but qualitatively these WBCs are normal. Now we come to the second type of proliferation disorders, which is neoplastic proliferation. In neoplastic proliferation, we are going to discuss leukemia and lymphoma, which are our main topics for today. So the first one is leukemia. It is neoplastic proliferation of bone marrow precursor cells. Now what is neoplastic? It is excessive and uncontrolled growth of cells which are malignant. The diagnosis of leukemia is made through bone marrow biopsy, which confirms leukemia. Now, as we know that the hematopoietic stem cell can be differentiated into two types of cells, the lymphoid and the myeloid. If the neoplastic proliferation is of the lymphoid series, it can be divided into two types: acute lymphoid leukemia and chronic lymphoid leukemia, short form ALL and CLL respectively. But if the neoplastic proliferation is of the myeloid series, it can also be divided into two types: acute myeloid leukemia and chronic myeloid leukemia, AML and CML respectively. These are the types of leukemia, and we will discuss this in some other lecture. Now, what is the difference between acute and chronic leukemia? To understand this, for example, we have a hematopoietic stem cell. It can be divided into two types of cells, the myeloid and lymphoid series. These are immature cells and they go through different stages to become the mature cells. So, if they are arrested at an early stage, they are called acute, and if they are arrested at later stages, they are called chronic. Early stages means the immature cells, which are the blast cells, and later stages means the mature cells, which are the site cells. So, to cap it off, acute means that they are arrested at early stages. These cells proliferate faster and they have functional deficiency, like they don't work normally. And chronic means that they are arrested at later or mature stages. These cells proliferate slow and they might work up to some extent, like they don't work normally, but they might work up to some extent. The important thing to remember is that here the acute and chronic does not mean the usual acute and chronic, like it does not involve any time duration. So acute and chronic depends upon the stage at which the hematopoietic developing cells become malignant, or the stage at which they are arrested. Now we come to lymphoma. It is neoplastic proliferation of lymphoid cells in a lymphoid organ. 99% of the times these lymphomas are found in the lymph nodes and 1% in the thymus. Diagnosis is made on lymph node biopsy. Lymphomas can also have the same acute and chronic lymphomas as discussed in leukemia, and that depends on the type of cell that becomes malignant. The most important thing here is the difference between leukemia and lymphoma. So, leukemia, when hematopoietic stem cells undergo malignant transformation and spread in a diffuse manner in the bone marrow and then into the circulation. These leukemic cells do not stick to each other and do not form any masses or clusters. So for example, this is the bone marrow. When these cells are produced, they don't stick to each other and they are spread in the bone marrow in a diffuse manner. These cells then migrate into the circulation. The important point here is to remember that in leukemia, very high level of WBCs are in the circulation. Now we come to the lymphoma. So lymphoma can also be described as the neoplastic proliferation of hematopoietic stem cells. But the difference is that these cells stick to each other and form a well-differentiated mass, and these cells do not migrate in high number to the blood. These masses are often found in lymph nodes, thymus, etc. So they usually reside in lymph nodes and thymus. There are too many overlaps found between leukemia and lymphoma, and it is difficult to differentiate between them. The main difference is the way they spread and behave. In simple words, the way they are distributed. So, to summarize the difference between leukemia and lymphoma, in leukemia, the cells are in diffuse manner and they don't stick to each other. Also, the level of WBCs in the blood is very high. While in lymphomas, these cells stick to each other and form a well-differentiated mass, and they do not migrate in high number to the blood. Leukemia sometimes converts into lymphoma. So for example, cells from the bone marrow migrate into the circulation and then into the lymph nodes, where they form a mass and turn into lymphoma. And lymphoma sometimes converts into leukemia, in which the cells migrate to the bone marrow and enters into the leukemic phase of lymphoma. With this, our topic for today comes to an end. I hope everyone is clear about the difference between acute and chronic and the difference between leukemia and lymphoma. Kindly like this video, drop down a comment and share this video. Also, if you haven't subscribed my channel, kindly subscribe my channel. Thank you.